we'd be sitting at a table and we would have a third-party agent bring in, and they would have quotes from Blue Cross and Humana and United and whoever else.
When your renewal comes up, it's whatever it is, and you've got to decide whether you're going to take that increase or go to another bigger plan or whatever.
Plan A, Plan B, Carrier A, Carrier B.
We never talked to any representatives of the company. All they sent us was numbers.
The big insurance companies, they're worried about Wall Street, worried about their stock prices.
It's just getting more corporate, larger. We're all seeking anything that still has some tangible personal value to it.
We want to control our costs at our bank's level, and we want to control our costs at the plan level, and that takes a lot of people pulling in the same direction.
When you join Advantage Health Plans, you join this family of great bankers, great business people, great stewards.
Being a member rather than just a customer provides us more access, more ability to give feedback.
I can call if I need to and have a say in what we're doing next year and how we're doing this.
That's a very unique quality of Advantage, is that y'all will get engaged and do a deal.
The depth that Advantage Health Plans went to make things work for companies, and the people depending on the coverage in the companies, was very impressive.
That we had better options and more options than we would under a traditional plan.
Health care, health issues aren't all cookie cutter.
That's kind of the key of Advantage, is that you're bringing a whole different paradigm to the equation.
That kind of personal attention that that we never really got when we were with a bigger carrier.
I can be underpriced for some products if someone's big enough to do it, but I can promise their service isn't the same.
And with Advantage, they want to be solvent and do a good job for their members. But the profit and the bottom line is not the focus of their operations.
Occasionally something was so unique and so far out of the control of the insured or the bank covering it, and it was just something that the board would sit there and know they needed to help those people.
Y'all stepped in and worked with both the employee and the provider to reach a mutual agreement to be able to provide services in the local area that we're in. So I think that's been a real benefit, that y'all are so hands-on.
Having somebody that's an advocate that has an interest in bargaining on your behalf as well, and so for me, that firsthand experience really, kind of sold me on the trust and the plan.
My employees are grateful to have that tangible personal value that comes with the Advantage Health Plans.
If you want to have control, you want to shop responsibly for medical services, Advantage is a good place for you to be.
It's unique that they have pioneered looking for providers that are willing to price their services at a fair market rate, and not the way a lot of providers have done for years is you don't know until you get the bill in the mail what the costs of your services are.
We're medical consumers out there, whether we're in Advantage or we're in some other plan. We're medical consumers, and we have options, we have choices, but we need to make informed decisions when we're purchasing non-emergency medical services. And that's what Advantage is trying to facilitate. And they give us, Advantage has given the participants a lot of tools to do that.
If you're going to talk about a pet peeve, at a bank, we have to disclose APR down to, the 100th of basis point, but you go into the doctor's office and they don't have any of their prices posted. What is that about?
I want to be fair And I think that we should expect some of our people who bill us to be fair, and that's where we've kind of all worked together to make that happen.
We need to shop for medical services the same way we shop for everything else. And because we haven't done that, that's the reason medical costs are going the direction they're going and at the rate they're going.
It's been a much better way to help manage that process and keep that out-of-pocket, maximum out-of-pocket number manageable.
And I think it's been a lot of fun to see our team as they realize it's not just the board, it's everybody's money. We all pitch in towards our health insurance, be more aware of their usages.
It's a philosophy. I mean, it's an ownership philosophy.
It's a lot more ownership to it than I am a customer of another company.
We want everybody to feel like they're vested.
We want our participants to take an ownership role in our plan. And they need to, because they are owners of the plan.
You are part of the trust, and you're impacting your fellow workers and the viability of the trust going forward.
As a Advantage Health plan member, we all recognize that it's our pool of funds. It is there to protect us and to pay for our emergency medicals and needs in medical arenas and such, but that we don't want to just be wasteful with it.
We're not talking about emergency care. We're talking about elective medical services that you can shop for, and people do have a choice on that.
It's, what can we do to save money and reduce costs and try to manage the healthcare expense for our membership.
We're going to try to minimize the inflation through smart choices, teaching our own members and team members to shop smart.
Because it's all got to come from the top. I mean, we can have that teller that's bought in 110%, but if it's not coming from the top at 110%, that teller's not going to be bought in at 110% either.
It's just something we've got to share so people can understand.
Premiumbeat.com.
I've looked at every expense item line by line. Our Advantage Health plan expense is something more in the way of an investment.
It's a longer term proposition than a year-to-year deal.
I mean, we either self-fund, be in a plan like this, or go out on the commercial insurance market, and we know what that's going to do for us. Might save you money one year, but long term it's going to cost you lots of money.
It's easy to premium shop if that's all you're doing, but that's a short window and you're going to face something else in 12 months.
We had changed back and forth from a couple of different providers over the years, and our experience was not great. It seemed like the benefits were declining each time we renewed, and the cost growing significantly.
We're not designed that way. I don't want to be a part of a plan that's designed that way.
When you're shopping for your insurance, you have to go past that bottom dollar premium. I mean, if all of us shop for the bottom dollar premium every time, whether it's health insurance, a new computer system, a new software system, you've got to look past that. There's a lot more than the bottom line.
I know over the last 4 or 5 years, our costs have went up dramatically less than what medical inflation as a whole has went up, and that's because of what we're doing and our philosophy, I think.
They do a great job, and I don't see any area that they could improve upon what they're doing.
I put a questionnaire out to the team, just, would you want me to shop for other insurance, just broadly? And I got back a unanimous no.
What we found is a very successful solution for healthcare for our firm.
It's better for the bank, and it's better for the employee.
We've been with Advantage for 40 years.
I am Advantage Health Plans.
I am
I am.
I am Advantage Health Plans.
We are Advantage Health Plans.